Much yet. Okay, we'll go ahead and get started. Thank you so much, everyone, for your patience. Welcome to the November CHPRMS Coffee and Communications event. My name is Carly Gabriel, and I serve on the CHPRMS Board of Directors and the Membership Committee. And I know quite a few of you have already introduced yourself in the chat. If you haven't, I encourage you to do so. Before we get started with our discussion, I want to mention two quick things. First, we invite you to become a CHPRMS member. We have events like coffee and communications, as well as lots of other learning opportunities throughout the year, and you get access to our member database, networking opportunities, and a discounted conference registration. And that leads me to our annual fall conference. It's just around the corner. This year, we will be in Charleston at the Francis Marion Hotel from November 30th to December 2nd. And you can still register to attend. You can actually register right up until the conference happens. So check out our website. It has session descriptions and the speaker lineup. All right, this morning, we're going to be diving into the topic of crisis communication. It's not fun, but it's a necessary part of our jobs that we need to be prepared for. Today, we're going to be hearing from multiple communication leaders. In a little bit, we're going to have with us two leaders with Lee Health in Florida. It's one of the largest public health systems in the U.S. We'll welcome Michael A. Nashef, who is the Vice President of Government Relations, and Mary Briggs, who is the System Director of Strategic Communications and serves as the Public Information Officer in that role. But first, we're going to hear from Melinda Daffin, who is the Director for Digital Content at Ochsner Health, which operates 47 hospitals and more than 370 health and urgent care centers across Louisiana, Mississippi, Alabama, and the Gulf South. Thank you all for joining us today. And Melinda, we'll start with you first.
Awesome. And you did a great job of pronouncing Ochsner. I'm super impressed.
Thank you.
All right. So when I was asked to do this on crisis communications, the first topic that came to mind was Hurricane Ida, which hit Louisiana last year on the anniversary of Hurricane Katrina, caused significant damage to a number of our hospitals. And I thought we did a great job responding to that crisis on our social website, internal, and so forth. But then I thought, you know what, these folks probably know a lot about storms. You were just mentioning the tropical storm, so that confirms my feeling. And I thought, why don't, let's talk about something maybe a little more timely, TikTok. If you haven't dealt with the TikTok crisis yet, you might. I hope you don't. But we learned some lessons from a recent event that happened, and I wanted to share that with you. So this all started, it was a Sunday evening in early June, and I happened to be the weekend social monitor, and I'm going to talk more later in this presentation about what our weekend social monitoring plan is, but I'm really glad we have one. So I was the weekend social monitor, and I happened to check our Twitter notifications on this Sunday evening, and I noticed a tweet. This woman was complaining about her son's care from 2020. And, I was like, wow, why is this person complaining about something that happened 2 years ago? And her comments were quite serious. I could tell it was more than the usual kind of patient complaint. Normally, myself or any other member of our social team would provide one of our scripted responses that have been written for us by our legal and our patient advocacy teams. They direct the patient to contact our patient advocacy department via email or phone number. And it also has some language about, we're sorry for your experience and so on and so forth. But I could tell there was a lot more to this story. So I thought, before I respond, I'm going to send this to our legal team, our patient advocacy team, our senior leadership, to see if they're familiar with this person, if there's more background that I need to know before we respond. I'm glad I waited, because there was quite a bit more to this story. So I did send that email off that evening. And then could I ask, if y'all are not on mute, you might just go ahead and mute yourselves. That would be great. So the very next day, our social team noticed on TikTok that that's where the real action was. So this person, although she did have a Twitter account with about 900 followers, she has over 600,000 followers on TikTok. And that's because she uses her TikTok platform for basically, I hate to say complaining, but that's what she uses it for, complaining about different organizations. So she has amassed a huge following. And the thing to know about TikTok, if you haven't delved much into that platform, is that it is the one platform where you can get a lot of organic reach, more so than just about any other platform nowadays. You don't have to be Kim Kardashian to go viral on TikTok. You can be just a regular person, and if your video just happens to catch fire, there's a great chance it can go viral. So she's had a number of videos that definitely have gone viral, and she posted a video that was 2 years old of her baby crying. It was, definitely something that would elicit sympathy from viewers because no one likes to look at a baby crying. And then she had some very strongly worded information to go with it about what our doctor did, with the care that the baby received. We did not feel it was accurate. We stand behind our doctor's actions. She had never filed a malpractice lawsuit against us. And so we realized this was where the real crisis was on TikTok. She also used her TikTok platform to direct her followers to bombard us on all of our other social media platforms, which they did. They went on all of our pages. We have 18 Facebook pages. We have a lot of different regional pages, service line pages, and so forth. They went on our Instagram, Twitter, and so forth. In our inboxes, they were commenting on posts off topic. These were people who lived all over the United States and in other countries. TikTok, you can have followers who don't know you, and she certainly did. And these were not our patients who were commenting on these posts. These were just her followers from TikTok who came over her direction. And then as the week progressed, we were dealing with more and more of these comments. A lot of them were very verbally abusive. They used, profanity. They were very hateful. I remember one tweet in particular that said, "You should kill yourself." It was really ugly and harsh. So that first week was a very rough week. And I'm going to show you how we managed all these things in the next slide. So the very first thing we did, which is what we would always do in any kind of social media crisis, is to alert our senior leadership team, our patient advocacy team, our legal team, and our public relations team. And they were kept informed throughout this whole scenario. We have a SharePoint site. We have a private document, tracking document, where we kept screenshots and links to every single thing that was posted. We still have those documents there if we would ever need to update them, but those were accessible for all these people that were alerted so that they could see, in real time what was being added. And I think that's really important. I think the screenshot aspect is really important too, because sometimes posts get deleted. That way, if you have a screenshot and a link, you can have a really good permanent record. One of the very first things we did was turn off stitching, duetting, and commenting on our TikTok account, because immediately some of her followers were trying to do stitching and duetting on TikTok. If you don't know what that is, it's where they can take one of your TikToks and do kind of a side-by-side screen, and then, say whatever they want about your video. So we turned off that ability so they couldn't comment or duet or stitch off topic about one of our TikTok videos. We temporarily disabled commenting on our Facebook and Instagram because there were just so many spamming comments. It was overwhelming for our social team to keep up with. So we turned it off temporarily. One of the sad things about that was this coincided with the US News and World Report announcement of best children's hospitals in America, and our Ochsner Hospital for Children happened to rank very high. So that was kind of sad because we had some social posts about that, but we really had to turn it off for at least a little while to cope with the volume of comments. Any spamming comments that did get through, we hid them or deleted them on all social channels. We don't like to hide or delete comments unless absolutely necessary, but like I said, a lot of them were abusive, a lot of them were off topic, and most of them were not being posted by our patients. Abusive commenters were blocked. Again, this is a step we rarely take. We hate to block people from our social media channels, but if someone comes on our channel and, threatens us or, uses the F word or something like that, we're not going to tolerate that. And we got a lot more aggressive about blocking abusive people, which I think is the appropriate thing to do. Now, this is a really important tactic that I don't know if everyone's aware that you can do. Videos that were posted on TikTok or Twitter or other social platforms that we felt like violated the community rules on those platforms, we reported those to the social platforms. So if you go to TikTok, like go to anybody's page, if you look at the top of that person's account, you can see a button that says report this user. You can report the user, you can report their whole page. You can also report individual videos. So there were definitely videos that she was posting where she was, she would comment, and she made a lot of these videos, by the way. She recycled her content frequently. A lot of times it was the same one or two videos that she would recycle with different commentary. She would say things that we felt like were simply not true. So we reported many of those videos for spreading false information or other things that violated TikTok's community rules. And you can view what the community rules are for all the social platforms. If you go to TikTok, Twitter, Facebook, any of the social platforms, you can find their community standards and what constitutes a violation of those standards. And you should feel free to report posts or videos that you feel like are violating those rules. And we were successful in having many videos taken down, which frustrated her. She did post some things saying, oh, they took my videos down, I'm so upset. But there's a reason they took them down, because they were violating the platform's rules. Another thing she did was directing her followers to create fake Google reviews of the doctor in question. So we worked with our provider, Yext, to help us report these fake reviews to Google. And we were successful in having those fake reviews removed. Obviously, you don't want to have a review removed that's a legitimate patient complaint about a doctor that they saw. But these were people who had never even seen this doctor. They were just, going on her information that these folks didn't have any context about what the full story was. So we were successful in having those negative Google reviews removed, which was really great, because for a while they really tanked that doctor's Google score. It was down to like 1 star. So I think we got it back up to 4 point something, which was great. As I mentioned earlier, we kept these tracking documents throughout of all the things that were happening. I think one thing I forgot to mention on this little flow chart here was another thing she did was she tried very hard to find out the names of the people who work on our social media team, because she was very frustrated by us deleting comments and things like that. She actually found the names of a couple of our social team members. I don't know how she did it. Maybe she went on LinkedIn and, searched for Ochsner social media, but she sent a couple of private messages to people, which we reported to our security team. And they did some intervention there, which I think is important. We don't want our team members to feel unsafe. So I think it's very important to include your security team if you feel at all like you're being harassed by someone on social media. She also reached out to our AVP for patient advocacy in a private LinkedIn message, and that made that person feel very uncomfortable. That was also reported to security. So throughout this whole crisis, we never responded directly to this woman. We felt like this was a case where it really wasn't going to do any good for the social team to give our little standard response. All of the responses to her were handled offline by our patient advocacy team and legal. They had numerous conversations with her. They had phone calls. They sent her letters. They invited her to do in-person meetings, which she refused to do. I think she was enjoying keeping the social media fires fueled. Like I said, she had never filed a malpractice lawsuit against her. And in fact, the statute of limitations had passed and she wasn't able to file one anymore anyway. But if you looked at her TikTok account, at the top of the page, she did have a LinkedIn or Linktree link that listed her GoFundMe, PayPal, and Venmo. So she was collecting donations from people who were sympathetic to her cause. So all we could speculate is that's why she was keeping this fuel, this fire going. But we didn't add to the flames by responding to her on social. We also never put out any kind of public statement by our PR team, and that was on purpose because we didn't want to call more attention to it with the media. So the outcome of all this, no media outlets picked up the story, despite her best efforts. She tagged lots of local media stations, national news stations, national publications, local publications. None of them picked up the story, which I think illustrated the fact that there wasn't a story to be picked up. Like I said, we stood by the care our doctor provided. So despite our best efforts, no one picked it up. After a few weeks, and yes, this did go on for a few weeks, unfortunately, social media users seemed to tire of the story. And after a while, people started saying, hey, you know, like, why do you keep talking about this over and over and over? Why don't you try to get this resolved with the hospital? So I think people after a while started getting tired of it and questioning why she kept, you know, posting these videos over and over. And as I mentioned earlier, TikTok removed numerous videos after we reported them for community violations. Also, Twitter removes some things as well. Her social media posts tapered off after about a month and a half, and she has not posted about us in a while. Hopefully it'll stay that way. So my parting thoughts are, be prepared. The best way, and I'm sure you know this, to handle a crisis is before one happens. So one of my first questions for you is, do you have a social media and PR coverage plan for the weekends? We've noticed a lot of things happen on the weekends. I don't know why. Maybe people just want to inconvenience us, but we have a very well-defined plan for weekends. So one of the things I did when I started at Ochsner 3 years ago was I created a social media monitoring rotation so that every weekend we have a designated person who is the point person for monitoring all of our social channels. We don't make them work a full shift, but they are responsible for checking notifications twice a day on Saturdays and Sundays. And if someone needs something handled, they know to call that person. So it's very unlikely something really big would escape this person on a Saturday or Sunday if they check the notifications on all the social channels twice a day. And then recently the PR team has started doing the same thing. So on Friday mornings, I send an email to all of our senior leadership and I say, here's your social media person for the weekend. Here's your public relations person for the weekend. So we know, okay, these are the people that we can call for crises over the weekend. Make sure your social media team is trained on escalating and managing crises before they occur. A lot of these crises are beginning on social nowadays, as I'm sure you know. We have scripted responses, as I mentioned, that are prepared and stored where everyone can find them, and all of our team is trained on how to use them and which one to use for different situations. Sometimes we create new responses for special situations, but we do have a set of general responses that work for most scenarios. And then we also have process documents stored that guide team members on how to handle various scenarios. We hold refresh trainings on managing crises. It's not train you once and then you never get trained again. So we remind people of how to handle these things on an ongoing basis. It's very important to use a social listening tool. We use TalkWalker. Brandwatch is another good one, and there's other ones as well, of course. We have TalkWalkers set up to send us trigger reports with mentions of our brand, negative mentions, as well as of our CEO. So if we get, any kind of negative mention on, it works best for things like Twitter and Reddit. Privacy rules on Meta and TikTok make those tools not super useful, unfortunately, for those platforms, but it's caught a lot of things for us on Twitter and Reddit that we might not have seen as quickly. So I think that's a great thing to add to your toolbox if you don't already use a social listening tool, and make sure you investigate their capability for sending you trigger reports immediately. The last thing I wanted to mention, if you have a big crisis, if you have a big enough social monitoring team, try to rotate the social monitoring responsibility among team members. When I excuse me, I'm getting over a little cold. When I started Ochsner 3 years ago, we had basically one person monitoring our main social channels every weekday. I changed that to rotate it because it can be a very heavy burden if you're dealing with something that is getting a lot of really hateful comments. Even though you know personally that, I didn't do this thing, or they're not talking to me directly, it can start to feel like it after a while, and it can take a toll on your mental health. So I think it's really important to rotate that duty, to check in with your team members, ask them how they're doing, make sure they're okay. Because even I, when I see those things, like that post I mentioned on Twitter where the guy said, kill yourself, I was like, oh my gosh, it made me feel terrible. And then this person, and the TikTok person, she would say things like, social team, I know you're doing this, and how can you live with yourself, and you're a terrible person. Even though she's wrong, it can still kind of hurt to hear those words. So definitely check in with your team, make sure they're doing okay, make sure they are aware of it, whatever mental health resources your company has to offer. We have a lot. I'm sure your companies do as well. but you want to make sure everyone's doing okay because it can be a heavy burden to monitor these crises. And that's it. Thank you for listening. Any questions?
Thank you so much, Melinda. Yeah, I think we should go ahead with questions for Melinda before we go to our colleagues at Lee Health. I have a question. You mentioned a couple time metrics, but from discovery of the post to commentary post tapering off, what was that time span?
About a month and a half. Yeah, it was a good time. It really dominated our social team's efforts for quite a while.
I have like a 1,000 questions. Did y'all bring in like an external? I mean, because they have like, you know, experts like sort of crisis situations like that. Did y'all bring in anyone externally, or did y'all just handle this internally?
We handled it ourselves. I mean, we're a pretty big organization, so this was a team effort with we had meetings frequently with our security team, our patient advocacy team, our senior leadership. I did do a call with another social team member with some folks from SHSMD who have dealt with crises like that before, and they said, you're basically doing everything we would do. So there wasn't a lot more I don't think we could do. I didn't mention our legal team did send this woman a cease and desist letter, which, you know, I don't know if it did much. It didn't really make her stop. She hired an attorney herself. She posted a video showing the cease and desist letter. So did it help? Did it fuel the flame? Not sure. I think the best thing that we did was reporting her videos to TikTok, getting videos taken down, deleting and hiding comments, blocking spamming commenters, getting really aggressive about that, because we rarely block people on our social channels. We hate to do that. But if you're going to come on our channels and say F you and things like that, we're not going to let you hang around on our channels. And if you looked on their Facebook profiles and their other profiles, they lived in like South Dakota, Canada, or whatever, they're clearly not our patients. So we didn't really feel bad about blocking those users. I think those were some of the best things we did. And then I think the record keeping is very important. Keeping those screenshots, those links, a running chronological list, keeping everyone well informed. I think those were some of the best things we did.
That's great. Can I ask one more follow-up? You
Sure.
said that no media picked up the story, but
Nope.
did you ever get inquiries from
Nope.
media?
Not one.
Wow.
Because I think if you looked at her stuff enough, like she would even post, oh, I called, you know, the local ABC affiliate and I had a conversation and they said they didn't think it was a story that we'd pursue. I think the fact that it was a 2-year-old case probably raised some eyebrows. Like, why are you just now like complaining about this thing that happened 2 years ago? And then when they would see, she would post like recordings of conversations she had with our patient advocacy team, where you could tell the person was trying to talk to her, and she would cut them off. And, you know, it kind of, I think, made her seem a little, well, I don't want to use a negative adjective. I don't want to get into that too much, but I think people could read between the lines. And like I said, some social commenters did start saying things like, why don't you just talk to them? Why don't you just go meet with them? They're asking you to come meet with them in person. Why don't you do that? I think, and the fact that she had her GoFundMe, her Venmo, her PayPal prominently linked on her TikTok, you could kind of read between the lines.
Melinda, can I ask briefly? This is, and I know I shouldn't as a presenter be asking a question, but I'm just curious. Did you all track the dollar threshold that she raised? Like, someone in your legal department had to have, yeah, been curious and wondered about defamation. So
Yeah, I mean, you could see on GoFundMe clearly how much money she raised, and she exceeded her goal. So I couldn't see, we can't see how much she raised on Venmo or PayPal, but her GoFundMe, she did really well. It's still up. People can still contribute to her GoFundMe today.
Karen asked, did you also report her to GoFundMe? Like when,
You know, we did not do that. That might have been a good thing to do. We did not do that. That's a good point. That would have been a good thing to do.
This is Carlin. How did you and your team keep up with this for so long? I know you said you have a rotating weekend schedule, but like, did you guys also rotate for this month-long endeavor that you had to endure?
Yeah, so we have a lot of social media channels, and fortunately, we have a pretty large team. So we already have a schedule set up, so a different person monitors our main pages every day of the week, every weekday. So it wasn't too big of a burden on any one person. And then we have, you know, like our regional pages, our CEO pages are monitored by different people on our team. So it never fell to one person, which is good, having it spread out. If it was like we had it when I initially started, there would have been just one person monitoring every day. So I think that's a bad idea. I mean, if you have a big enough team, obviously, if you have a really small team, you don't have much of a choice. But if you have a big enough team to rotate that duty, I think it's a really good idea. Also, social media monitoring takes a lot of time, even when you don't have a crisis going on. If you're a big organization like ours, it's hard to do much else. And like our social media team members do a lot of other stuff besides monitoring social. So I hate to have one person do that all the time.
I have one more question. I'm
Oh, go ahead,
sorry.
Karen.
Yeah, I have one more question. How did you get buy-in from your executive leaders to not respond?
I mean, my initial feeling was we shouldn't, because I felt like it would fan the flames. And I would say one great thing about our senior leaders is that they trust us as social media experts. We're the ones who live in this every day. And so, you know, I mean, I'm not going to say they would never override our decision, but I think they understand that we're the ones who really understand our platforms. And so, you know, they said that was fine with them. And when I did that call with Shishmid, I mentioned that, and they said, yeah, we wouldn't do that either. So I was like, all right, our instincts were good. Someone asked in the chat, what impact does time spent on social media have on bringing new patients to your physicians? Do you mean like, how do we, Emerson, do you want to, can you explain that question a little bit more?
Well, it's basically, you obviously spend a lot of time and have a lot of people involved in social media.
Yes.
Does that have any relationship to the number of new patients that come to your physicians?
That is a great question. We care deeply about bringing in commercially insured patients to Ochsner. We are a nonprofit academic teaching hospital system, but to pay for all the good things that we do, we need commercially insured patients. So we devote a lot of time to promoting our physicians on social media with positive posts that you know, illustrate the care and passion they have. So we link out to their profiles on our website with every post that we do. We do a lot of heartwarming patient stories. We have a lot of fans on social. Really, most of the comments we get on social are overwhelmingly positive. This was an aberration. But most of the posts that we put up, you know, whether it's patient stories or a photo of a doctor with a quote about why he or she is passionate about what they do, a short video, you know, those things definitely result in bringing new patients. We track, you know, visits to our landing pages, and we can see the direct effect that social media has. So it absolutely has an effect. If you're not doing that, you absolutely should. Social media is such a powerful tool. It's where a lot of people spend a lot of their day nowadays. So a lot of people get their news on social media. And definitely you should be on TikTok, by the way. We are really getting into TikTok. We just hired a full-time social media specialist that his main job is making short form social video for TikTok and Instagram Reels. That's it. That's his job. And he has made some really, go to Ochsner Health and check out some of our recent TikTok videos where you can see some of our doctors highlighted. We're having a lot of fun with it. And like I said, this is the channel where you can get the most organic reach nowadays, y'all. Facebook organic reach is dismal. I'm sure you know that. It's under 5%, which is really sad. So if you want to reach a lot of people, not just teenagers, there's a lot of older people getting on TikTok nowadays. I strongly recommend you create a TikTok account.
Thank you so much, Melinda. So I think we'll go on to our next presenters in the interest of time. Again, Michael is the Vice President of Government Relations, and Mary is the System Director of Strategic Communications and also the Public Information Officer for Lee Health in Florida. Thank you so much to you two for joining us this morning. So I'm going to start us off with a couple of questions. Can you set the scene for us and tell us about the impact that Hurricane Ian made on Lee County and also the effect that had on Lee Health?
Thank you, Carly. Yeah, absolutely. And Mary and I plan to do this conversationally, and we want you all to kind of jump in. So I'm going to give you a bit of size and scope of Lee Health and let her work on answering some of the questions related to communications, because obviously that's paramount for this discussion. But just so you all know, Lee Health is a large public health system based out of Lee County, Florida, primarily Fort Myers, but we have 4 adult acute care hospitals, 2 specialty, a children's hospital, a little over 15,000 employees, roughly 2 million patient contacts a year. It's a big organization, but what makes us unique is we have a publicly elected board of directors, 10 members countywide, and we don't collect a tax, unlike most public hospitals. So we're more than a centennial system. We've been around for a long time. We've seen certainly a lot of hurricanes. And with all those employees and all the time, I think I wanted to set that stage so you get that when Hurricane Ian made landfall here in Lee County, hospitals don't close, right? Our acute care facilities stay open. They keep delivering care. We have a team A and B, and we, throughout the storm, have to implement a plan for keeping our operations going, right? So we had thousands of employees and patients on site at all of those hospitals receiving care during this storm. The challenge, I think the greatest one for us in terms of what we observed is that Hurricane Ian came up the coastline, it kept its power, it stayed over the water, the eye of the storm, and it meandered, it moved very slowly. So it never lost its intensity for quite a significant period of time. We're talking about hours of significant wind and storm surge event. Health Park Medical Center and Golisano Children's Hospital are 9 miles from the Sanibel Causeway. Where I'm sitting now in my office is right there. And so I'm sure with all the comms experts on this call, you know that Sanibel took the brunt of that storm. I'm sure you've probably seen images of the Sanibel Lighthouse, the causeway, how the island had been disconnected from the mainland. We also have Fort Myers Beach, similarly 8 miles down the road. And many of our patients, many of our staff live in the most impacted areas, the Iona-McGregor corridor, Cape Coral. And so you can imagine, as the staff at Health Park Medical Center was in the midst of this storm delivering care inside of the building, they were watching their cars being flooded out of the parking lot. So the 9 miles I referenced away from the coastline, we saw the storm waters come in further than they ever had, that storm surge in Lee County. And so it was quite a sight when we had roughly 4.5 feet of water just outright destroying all of their cars in the parking lot. We've since covered the deductibles for those staff who lost their cars, for the cars that were insured, as a mechanism for helping to get them back on their feet. But overall, Lee County has unfortunately experienced roughly 64 deaths as of today from this storm, and that number is still likely to grow. Statewide, the official death toll is 140 from Hurricane Ian in Florida. So you can tell that the most impact was here. The insured losses across the state are over 9 billion now. The estimates expect that to be a lot closer to 60 billion. When it's all said and done, and that includes flood, wind. It was wide-ranging impact, but the storm surge primarily in Southwest Florida just caused total loss. We've been out on a number of the barrier islands, and we're working hard to try and stand up mechanisms for care. But to answer that first question, the impact was just significant, both from a physical perspective and what it did to our facilities during the course of it, and maintaining operations at large points. Obviously we lost power. In Florida, we have requirements for generator power in state law. we would have been fine to maintain power at the facilities for roughly 3 weeks if we had to. We have diesel fuel generators are all raised. We're ready in that instance. Where we found challenge was utility water. So we're dependent on 2 municipalities and a county for delivery of our water systems. And what you learn pretty quickly is that water tankers cannot meet the need for fire suppression systems, kidney dialysis, potable water, flushing toilets, running coolant systems for air conditioning. We have a lot of use for water in hospitals, as you all know, and a lot of requirements. And so primarily the largest concern that led the decompression of of 3 of the facilities after the storm was utility water. So I think that probably gives a pretty good idea of where we stood in terms of impact.
So it sounds like you had multiple audiences that you needed to communicate to, both internally, externally, and the community and patients. So when did you start enacting your emergency communications plan, and what does that look like for your team?
Mary?
So we started meeting as part of an incident command system about 5 days before the storm. At that point, they thought it was going to hit Tampa, which is a couple hours drive north of here. But of course, we start to do all of our preparations. And, the first few days, we're just sending out a daily e-blast. We're having a call with about 200 of our leaders every day are invited into the call, just keep them updated on what's happening. But then obviously, as the storm, approached us, it looked like it was going to not be Tampa and was going to be here. And so we, stepped up the communications. And all of this time, I'm thinking of every one of our audiences. There's the media, there's internal, there's the community, there's our board of directors, there's our medical staff. And we're trying to get all of it out to all of them, the same consistent message about what's happening, how we're preparing. A big message before storm is we are not a shelter. We don't want people to show up to shelter in our buildings that are, obviously capable of withstanding, Category 5 storms. We do have people that show up though. And then we have, we're the special needs shelter for people that are, let's say, are on oxygen, that kind of thing. And so we do take some of them in as guests, not as patients. So just, kind of ticking through all of those audiences. And then what was fairly unique about this storm is the lack of connectivity as the storm hit us. There's just, no cell coverage, hardly, no internet. We still have people today who do not have power more than a month after the storm, just, mostly in the barrier islands. So a lot of time we were probably shouting into the wind, right? We're sending out these blasts, we're sending things out to media. One of the local TV stations, the one my husband works for, was off the air for a couple of days. They flooded. So, we're trying to get the message out, but a lot of the messages couldn't get anywhere because, you're really relying on digital needs. But we do have a mechanism that we had started in the pandemic of a daily e-blast that goes out to all of our employees. And it would be just like a synopsis of all the things you need to know today to, handle whatever the crisis is. And we used it to get information out about the storm at first, and then how did our facilities do, which, except for the water pressure, they did pretty okay. There wasn't a ton of wind damage. And then our employee relief efforts, because obviously our employees live in our community, and great amount of them had lots and lots of water damage to their homes.
So you touched on it a little bit there, but so what were some of the challenges that you faced in addition to lack of cell service and lack of power?
Well, because of the lack of water pressure in our hospitals, first of all, we did have to evacuate our children's hospital. We did that successfully. We moved, I think it was 61 babies. We were ordered to evacuate our 2 of our hospitals, and we did start to do that. And we moved about 350 people. But, as the storm is over, the emergency operations EMS starts up again, and they had like countywide, I think they had 1,100 calls pending. So, so as we're trying to decompress, people are coming in because they've been injured by the storm. So that was kind of interesting. We did have a field hospital set up a few days after the storm to help us with that decompression. But the water pressure, and you guys probably all have this too. We have emergency water protocols. We call them red bagging, right? You can't flush the toilets. So you have to pee into a cup and you have to poop into a bag. All the patients, all the staff at our hospitals. It's not pleasant, right? We had a couple very unpleasant days while they're trying to get the water pressure back working, like the utility companies. And, generally 99% of our staff are like, well, this is what you have to do. It's an infectious, prevention technique that you do. But we did have a couple nurses reach out to NBC Digital, and at the same time that NBC Nightly News was on site at Health Park Medical Center doing this fabulous story with our nurses about how well we did with evacuating these little babies, the digital platform was doing a negative story about conditions in the hospital. And of course, you know how it is when something's negative happening, you're paying way more attention to the negative thing instead of celebrating the great positive thing that was happening. And then a nurse who used to work for us was posting a lot on social media about conditions, and similar to what you heard earlier on this call, it wasn't necessarily accurate. She was certainly twisting the facts to make it look like we had been totally unprepared, which was not the case. But she didn't have hundreds of thousands of followers, but she had several thousand, and so we did spend some time, trying to calm her down. And because of the NBC Digital platform, not because of her, other publications then picked that up and started calling. And it was, the challenge was, even after the water pressure was back, toilets are flushing, everything's, cleaned up, they were thinking we were still under those conditions. And so there was a lot of, education that we had to do to make people aware of what was really happening. We did get a ton of national news coverage. Our CEO, Dr. Antonucci, was on CNN, Morning Joe, as I mentioned, the NBC Nightly News. We had like 3.6 billion impressions over the course of I'd say 10 days prior to and following the storm. So it was quite intense just to get all those interviews in and make that happen.
Just to wrap up that point really quickly, in terms of the question of what were some of the challenges you encountered, the old Mike Tyson quote, everyone has a plan until you get punched in the mouth, right? So that's a lot of what we experienced. We had a very robust plan to deal with every problem we were faced with. It's just, in terms of the connectivity, when you have a comms plan, but you can't get an email or a text message or a call out to someone, you have to physically start talking to the unit leaders or security and ask them to go check on them. When you have individuals who have lost everything, their homes, showing up at the emergency department, wanting access to just air conditioning and water, you have to think through calling the National Guard because nurses are getting physically harmed, or when you have a plan for fire watches because when a fire suppression system goes out that the regulators are going to say you have to start decompressing the hospital, but 5 water tankers isn't enough to generate 70 psi to put fire suppression up to the 8th floor of a hospital building. You just, in real time, you start to learn very quickly that all of your robust plans are only worth the paper they were written on, and you got to be ready to just be amenable to the situation. So we had, and to Mary's point, we were talking to everyone. Her team did an amazing job of getting the communications out, but those first 72 hours we were kind of in the dark, just trying to, we were fortunate that our command center, all of our senior leaders showed up despite, some of their own personal losses that they dealt with, and the comms team was there. And so we were constantly, on the phone with all of our regulators, from governor's office to the White House to FEMA, to, Agency for Healthcare Administration, Department of Health, because they were getting folks on the ground to tell us whether or not we could stay in operation. And we knew fundamentally that even if we were decompressing, people were going to show up at the emergency department. So to the point of, we were getting calls from the Surgeon General saying, well, wait a second, you transported 150 patients today. Why isn't your census going down? Well, because 200 showed up in the emergency department and they're injured from the hurricane. And because of EMTALA, we can't turn them away. We have to admit them into the hospital. They're injured. And so we really, again, just back to that one succinct line, you have a plan, you get punched in the mouth, you pivot.
I personally have so many questions for you both, but I want to open it up to everyone else. Does anyone else have questions for Michael or Mary? Well, I'll start then. So what do your communications look like today, and how much of that is still focused on maybe recovery efforts or, following up?
Yeah, I would say today there's quite a bit less. For about 2 weeks there, we're having at least one e-blast go out a day, and then fortunately earlier this year we replaced our very old intranet with a new one that's easy to post to, and it's attractive. And so we were putting stories on the homepage of that, and created a couple Hurricane Ian pages that people could go to. And so the intranet is definitely being updated, probably every day. But the blasts aren't, I think we had one last week, and it's everything at this point is like just reminders about employee relief. Here's where you can go to get resources, or, things about hurricane pay, or we have a contract with Lyft, and we're letting employees use it for free to get to and from work. And so we keep extending that. We extended our child care centers they were free for quite a while. I think that finally just ended last week. So those kind of messages were continuing to go out. And then, of course, Nicole comes along, and so then we have to start doing e-blasts about that. But we ended up not really being impacted by that storm. So now we're trying to just turn back to normal operations.
Can I ask you, Michael said, like you have all these plans for electronic communication, and then it goes down and you can't do that. So like, what did you do? Were you printing things out and like hand delivering? Like, did you have a system of runners? Like, how did that work?
They have people in we have a system-wide incident command, which is where I'm stationed, and then each of the hospitals has an incident command. So they do those things on a hospital basis as needed. They have a safety call every morning with all of their hospital leadership. And so that's a great way to get information out. And so, some of them, I wouldn't say probably all of them, they would read whatever the communication was that came. But of course, the hospitals had power. It was more, the people in Cape Coral Hospital that, for 10 days, I had several employees that didn't have power. Most of us, have been working from home during the pandemic. We were able to get, we got some Starlinks, which Michael got for some of the bigger things, but through AT&T, we have a safety net system. So one of my employees is using that. So it's like a big hotspot, and you can pretty much run your whole home on it. And so she's using that because she still doesn't have internet, and probably won't for months.
So Mary, the build on that point briefly too. So we have our CIO had the foresight, Rick Schooler, to get these FirstNet devices prior to the hurricane that we just hadn't yet disseminated. But the physical limitation on those is they're a little bit bigger than, like, say, your cell phone, and it's a personal hotspot that can generate enough connectivity for a period of time. You charge it, it runs off a secured cell phone line, and I think it's AT&T that runs it. The challenge with those is that you can only physically purchase so many. I think after the storm, what I've personally learned in terms of the extending direct comms is Starlinks are incredibly useful. So the state of Florida was granted 120 of them directly from Starlink and Elon Musk. They made a big deal receiving them. And then we were asked to put in a mission request and deploy them because we were closest on the ground. So we received 35 of them at Lee Health. And my team and I have gone out, and really all you need is stable power and a clear line of sight to the sky and a way of protecting the router. And you can connect up to 120 devices, and they all have high-speed internet. And so we started with first the DMATs, the federal units that came down and were right outside of our emergency department so they could have access to electronic health records and work with our systems. We then started going out to mobile locations, our outpatient units, as they were getting power back in the most highly impacted areas, and letting our staff know, here's the Wi-Fi and the password, log on, check your emails, file your insurance claims, check with your family, do telehealth visits. So that was the other thing. We've now extended at least 12 of them to the barrier islands. And so what we've been able to do is post-storm, we had free telehealth extended for a period of time. We had done that a few times during the pandemic. So we got on social media and we got e-blast out and we told people, we have free telehealth, and we can also create the internet access so you can stream it, and you can know, you cut yourself post-storm, you can ask a doc, do I need to come in? Or, all the normal questions you would do for a telehealth visit. The one gap in that that I found is that I'd like to be able to start implementing like a telehealth truck of sorts, and that's going to be a request for the legislature this year. I want to put an RN and a pharmacist on a mobile unit and send them to those locations, and then not having post-hurricane impacts and communities of socioeconomic interest that need that help, that we can physically send those units to. So we're really learning a lot from this, and I think we're going to be better for it.
Any last advice to communicators out there?
Well, I think Melinda said it earlier, be prepared. We have a crisis communication plan. We update it every year. We've got a really good HICS structure for incident command. It's a little military based, but it works. And having everybody all in the same room is very helpful. We were at one of our big outpatient centers for incident command. It was built just a few years ago. I felt completely safe in that building. If we were in an interior room, I didn't know there was a storm, except I was watching it on TV. I mean, and that's why everybody came into that building. All the leadership was there. It was easy to make decisions and, stay connected that way.
Just to add to Mary's point, she's absolutely right. Have everyone together. Everyone that you need for your decision-making structure needs to be physically together as much as humanly possible. And, in those immediate hours of the event, and it could really be any major event, but in those immediate hours while it's happening, they need to be together for decision making. And then immediate post-storm, it's dealing with things like opening the doors once the winds die down, making sure the facilities are physically okay to operate, starting to deal with the things like the potable water or the fire suppression systems, and implementing a plan right away to handle those things not working. But then as time goes out a little bit more and the incident sort of becomes your operations, and you have to utilize that structure in a manner that works for communicating to the general public, your partners in government, all of us, no matter what our governance status is, whether you're private, not-for-profit, or public, that government regulates roughly 80 to 100% of what all of our systems do, right? So we need to have direct comms with those leaders, and then all of our decision makers in the room to be able to act. And that's it. Be decisive, put your plan in place, and be ready to pivot.
All right, thank you so much to Michael, Mary, and Melinda. This was a really great discussion, and we really appreciate you spending your time here this morning. And thank you to everyone who joined. We hope that you will consider becoming a member of CHPRMS and also attending our conference in the fall. I just put a link in the chat to our website that showcases our conference and all the speakers and the sessions that we have lined up for just a couple of weeks away. So thank you again to everyone for joining us, and hope you all have a great Friday.
Thank you.
Thank you all.